You're watching Beyond Markets, where we bring you up to speed on development outcomes in Africa. Welcome. Thank you for joining us today. I'm Esther, Awoniyi. On today's show, we'll explore what additional measures Nigeria could be taking to better contain the coronavirus pandemic. As always, you can join the conversation on social media. Let me know what you think about the topics we discuss, and to do so using hashtag Beyond Market. You can also send me a message on Twitter to my Twitter handle. It's at Esther O. Awoniyi. Now, on the 27th of February this year, Nigeria announced its index case of the novel coronavirus as health authorities activated the multi-sectorial National Emergency Operations Center. Now, since then, the World Health Organization has declared the disease a pandemic as it spreads to over 100 countries. Now, to discuss Nigeria's efforts to contain the COVID-19 pandemic, my guests today are Dr. Babaseyi Oyesola, consultant in Anaesthesia and Critical Care, and Akintunde Sawyerr, former head of supply chain at the National Health Service in the UK. Thank you, gentlemen. Good morning. Pleasure to have you on the show today.
Thank you, Esther.
Akintunde, let me start with you. Just general thoughts, a question for both of you first, in terms of how your thoughts on our strategy at this point, which is to enforce social, or practice as it were, social distancing and to flatten the curve. We know that right now, majority of our cases are imported cases, those who are returning from overseas. So the idea is to self-isolate if you think or believe you've been exposed, and then, of course, practice social distancing. I can know your thoughts.
Well, I don't think we really have a choice given what we know. I think social distancing is an absolute necessity when you have this sort of threat anywhere in the world. I think that is a strategy that we must employ. I think any opportunity for people to get too close to one another is one that gives the virus the opportunity to spread. If our objective is to reduce the spreading of this virus, then clearly we must, as much as best we can, keep people apart. There are obviously measures that have been taken to ensure that that happens. Given our penchant for wanting to be at parties and in religious centers, there are clear opportunities where we can actually restrict the coming together of people until we get over this and understand it much better. So I'm in full support of the social distancing, but of course there are other strategies which you haven't asked about, but it cannot work on its own. It cannot work, pardon the pun, in isolation.
Absolutely. Dr. Babaseyi, your thoughts. You're a doctor, you also work in critical care. How are you processing all that's unfolding right now?
Well, I think any which way, it is the strategies that have been employed elsewhere that we're going to continue to deploy. But for us to get good results, good outcomes, which I think is what we're driving at here, we have to begin to look at our peculiar social circumstances. We have socio-cultural issues that we really ought to be overlaying on the effects and the performance of these containment measures. Because containment, as it were, would require absolute and complete restriction. And it's not even possible, not even in the West, in the UK and in the US, where they're doing their very best. And they have resources to augment the efforts of individual citizens. They're having difficulty. So the reality of it is that, yes, we use the same old strategies, but the extent to which we will be successful in this environment will depend a lot on socio-cultural.
Some might point to China and say China did it. China went on full lockdown, and it appears that it has worked, and they're sort of coming out of it right now.
Remember I mentioned the socio-cultural type of influences that determine whether or not you can be successful using any one chosen strategy. Now, China is a completely different country, socio-culturally. They are well known to be obedient, and their culture is such that, and has been, this is one of the reasons they're a successful industrial nation. Everybody behaves themselves, if you know what I mean. Sit, they'll sit. I can't say the same for us.
Akintunde, let me bring you in here. The UK, just to step outside of our shores for a moment, the UK is also taking containment measures. Parts of London, if not all of London, except for essential services, have been locked down, have been shut down. And what we're hearing is that they could be like 2-3 weeks behind Italy. And what is happening in Italy is just an absolute tragedy right now. And of course, so many things to learn from Italy, even the doctors and the authorities there, keeping everyone abreast and just basically telling us the lessons that can be learned from Italy, what to do and what not to do. But tell us, I mean, your experience. You did a couple of years ago, you were part of a team that was put together because UK was expecting a pandemic. Tell us in terms of what the kind of structure that was put in place, and perhaps if that's been activated now, if it's making a difference at all.
Okay. So, in 2008, the UK was expecting a pandemic to hit. They started to prepare for this pandemic in 2005-06. My involvement in that was on the stockpiling of medical consumables. So I'm not a clinician.
Okay.
My expertise is in the critical care supply chain,
Okay.
Whether it's food or medication or pharmaceuticals. And at the time, I was heading up the initiative for London for the stockpiling of things like face masks, alcohol gels, wipes, gowns, protective gear, goggles. These types of materials were critical to London because there was a clear understanding by the NHS that the first people you want to protect and stop from going down are the healthcare practitioners, the people who are going to look after the people who would inevitably be infected. And so there was a little segmentation around, who you would need to protect first, who was more valuable to society in terms of a pandemic hitting. And we began a process of stockpiling, as I say, the consumables I talked about, and taking a view on what the best consumables were, and bearing in mind that no one knew when this pandemic would or might hit. We also had to get involved in stock rotation because of expiration of products. We had to look at who the critical staff were, the distribution channels, the drivers, the ambulancemen and women, the clinicians, the nurses, all the people who, we felt if the pandemic hit and we did go into splendid isolation of society, who would be able to service the needs of society to make sure that when we come out at the other end, there is a survival of the race, if you like. It was very detailed. We put together a consumable stockpiling group. We interacted and interfaced with clinicians like Dr. Oyesola to get an understanding of what their requirements were. We recognize that there's a limit in terms of resources. You can't provide everybody with everything, but you have to provide those who need to have it to treat those who might survive or need treatment with whatever they need. Just to go back to your comment earlier about the UK being a few weeks behind Italy, you're absolutely right, but you also need to remember that every incident, every activity is a learning opportunity. And as we've talked about, we want to flatten the curve. So actually, there's a lot of work going on. There are lots of people not sleeping, looking exactly at what changes can be made so that we don't have a repetition across. Because
I asked that question because I wanted to know because there have been conversations about countries who already have some kind of structure in place, either through a already good health system. We know that Italy has one of the best healthcare systems in the world, but because the cases are coming too fast and too soon and treating so many people at the same time, that's why they're probably overwhelmed at this point. But Dr. Seyi, for a country like Nigeria, we've activated the multi-sectorial National Emergency Operations Center. I suppose this came to be during the Ebola outbreak. We did put something in place. The CDC, it's been revamped since then. There's been this widespread awareness. I remember then using hand sanitizers. That culture didn't particularly go away. We sort of at the back of our minds here in Nigeria just had that, let's always sanitize our hands, etc. But just take your mind across Nigeria's healthcare system right now, the structures that we have in place, and how prepared we are in the event, hopefully we don't see that happen, where we do find ourselves dealing with a community transmission. We have the center at Yaba, the infectious disease center at Yaba, that are treating the current 27 cases, I believe, that we have right now in the country, or 22 in Lagos. How prepared are we? Are we staring at a situation where we could become overwhelmed? Because those are the questions that are going around everyone's minds now. If we do find ourselves in that situation, can we cope as a state, as a country?
It's a good question. The short answer is we might be able to cope, but we don't know for sure, and I'll tell you why. Now, severity is a very big part of that equation. and nobody talks about it. It is possible, as we already appreciate, that 80 to 90% of all that are infected will just recover with or without treatment. It is that very small percentage that become severely ill to the extent that they need intensive care, ventilation, mechanical ventilation, and significant respiratory support. It is that small proportion. Now, Nigeria is a country of 200 million people. So 1% of that is a lot of people. I'm not sure that even in the United Kingdom, if we had, just for example, if we had all the resources that the United Kingdom has, I'm not sure that we'd still be able to cope, purely because of our population, if the same severity applies.
So we'd have to rely more on people being cooperative when the government says, you know, socially distance yourself. If you think you've been exposed, help us by isolating, and let us just prevent the spread by, you know, social distancing. Is that our best strategy at this point?
Absolutely.
Even if we have, like you're alluding to, we have the best healthcare system in the world, the required personnel or manpower. If we have too many people, we would find ourselves in that same
absolutely
boat.
right.
Akintunde, thoughts?
Yeah, I mean, Dr. Oyesola pointed to something that's really interesting earlier. He talked about socio-cultural behavior, and I think, you know, you can look at the whole issue around social distancing, self-isolation, in the context of the culture of the country that we live in and our own people. And, you know, we need to be careful that we don't just do a simple copy-paste. China has one way of dealing with this to get the outcome of self-isolation, social distancing. The UK has another. The Italians have a different one. Italians, for example, get up in the morning. They don't have coffee at home. They go to a cafe to hug and kiss and have coffee with their friends. And they also have a very large elderly population. And we know that that's a segment of society that's particularly vulnerable. So actually, in our environment, and I did mention this earlier, it's about understanding, you know, there's a push and pull, there's the incentive to stay away from other people, and there's the punitive as well, which, you know, we need to at some point think about, that those who deliberately decide not to sort of follow the advice given by government and the WHO and everyone else, how do you either incentivize them to begin to look in that direction, or how do you, you know, create a situation where actually, you know, if they're putting other people at risk or causing a threat to society, how do you deal with that? These are political issues, or issues that politicians will make decisions on. But from a clinical standpoint, you know, the objective is where we're trying to get to, and we need to understand that, you know, there are certain places where we, as Nigerians, gather. How do we sort of make sure that we
that is reduced to the barriers as much as we can?
Absolutely.
Gentlemen, thank you for your time so far. We'll just take a break at this point and come back and continue our conversation. I've been speaking to Dr. Babaseyi Oyesola, consultant in Anaesthesia and Critical Care, and Akintunde Sawyerr, a former head of supply chain at the National Health Service in the UK. We'll continue our conversation after this break. Do join us again. Welcome back to Beyond Markets. If you're just joining us, we've been assessing Nigeria's efforts to contain the spread of the COVID-19 pandemic. I've been speaking to Dr. Babaseyi Oyesola, consultant in Anaesthesia and Critical Care, and Akintunde Sawyerr, a former head of supply chain at the National Health Service in the UK. Gentlemen, thank you for your time so far. Let's talk about the issue of testing. What we've seen from what other countries are doing abroad, and what has been highlighted, you know, very significantly, is the fact that testing is important, especially if there's been a community spread. Testing is important. The more people you can test, you know, the better your chances of better containing and dealing with the virus. And we've seen a country like the US and UK, we've seen their numbers jump because there's been an increase in testing. So the question is, Dr. Babaseyi, let me start with you. For a country like Nigeria, are we already at a stage where we should be testing people? Because right now, the data that we have is that our current cases are those that have been imported, so we know where they've come from, and hopefully we're able to trace their contacts. Just put a bracket or some kind of net around them and test them. But should we be testing, whether or not that is our situation right now?
Well, the short answer is yes, we should be testing. Indeed, everybody, everywhere in the world should be testing.
Even for those who don't have a community spread?
That's the short answer. You want to know if the person who is coming with a fever, shortness of breath, and a cough is actually positive or not, whether it's in, whether it's out. That is the short answer. But the reality is quite different. Test kits are in short supply. That you've tested somebody and that person has come back positive doesn't add any benefit if they're going to recover anyway. All it tells you is this person might spread, and so let us do, which we're doing anyway. Let us try and contain and keep them at home. Don't go anywhere, stay at home. That's the missive. So yes, it would be fantastic in theory to test everybody, especially the ones who you think have come in contact. But we don't have those resources.
So there is a real danger that we could wake up one morning and realize that we've had a community spread all along while we were testing those who were classified as imported cases, because that's what happened in a place like New York, even in the U.S.
Absolutely.
We later found out that it had been spreading in Washington, rather, D.C., that it had been spreading for weeks before. I'll ask you that question again. Are we facing that risk of waking up one morning and realizing that we have several cases on our hands, not imported but local?
That's an easy question. Quite possibly, yes.
Can we move now to stop that?
No, I think the horse has bolted. I think the barn door is open. Let's hope and pray that severity-wise, we don't suffer the same. There are just too many people in the system already who have the disease for us to say, oh, we're never going to get that peak. I think we will. What we hope is that we don't suffer the same severity of illness.
Akintunde, let me ask you this. Now, this is a time where we've heard stories about the shortage of masks, shortage of ventilators, shortage of just medical supplies, and we're seeing that disruption to supply chains, not just even medical supplies, other things, and we're hoping that will not escalate. But just your thoughts on how we can ensure that on that side of things we don't suffer that kind of fate where one day we're looking for masks, we're looking for gloves, hand sanitizers. I guess that ship has sailed already. It's very hard to find hand sanitizers at the moment. But where are we? Because I know the CBN has said pharmaceutical companies will get some funding if they need to source locally, materials locally. So I guess that's a good start.
Absolutely, that is a good start. I think whenever you have a situation like this where it's difficult to quantify exactly, how severe, as Dr. Oyesola said, or widespread this is going to be, you're always constrained by limited resources. You're going to be constrained by equipment, and you would have heard the Health Secretary in the UK several weeks ago saying, if you make ventilators, go and make them, we'll buy them. Who talks like that unless they're in a situation where they're absolutely wanting to deal with a situation. There was no negotiation, just go and do it. I've also heard a report, I think, out of the US, where I think the governor of New York was saying, if you're making designer dresses, stop it, go and make masks. Okay, we are in a situation now where, resources are limited. There's no time to put out a big public tender to say, we would like you to supply the government with masks. Everybody's got to put their hand, has got to get on the deck and ensure that whatever they can do to produce, whether it's personal protective equipment or hand sanitizers or testing kits, wherever there is equipment, consumables that can help contain, help reduce, help alleviate suffering of patients and protect the healthcare practitioners who are really at the front line of this. We've got to kind of continuously redeploy resources, materials. There are countries across the world who have excess material that perhaps don't have as widespread an issue. The government should be talking to them. The government in Nigeria and the private sector, healthcare providers should be talking. Everybody should be sitting around the table saying, what do you have? Where is the issue? What do we need? How do we move it around? We can talk about, you know, how we pay for it later, but there's no time to have a long, drawn-out discussion about, you know, where and how you deploy resources. But you must protect those who are going to look after people. You must protect those who are going to deliver consumables, and you must be able to reach people who are self-isolating if there's an issue or they require anything from a bottle of water to food. You know, we've just got to make sure that we understand what resources are required and how we're going to get it to the right people at the right time to reduce the spread and to alleviate suffering.
So many moving parts here. Dr. Shea, let me ask you this question. Now, right now we have the Infectious Disease Center at Yaba, and the Lagos State Governor just announced that there'll be 5 other points within the state. But as for Lagos State, we'll keep it to Lagos State for now. As a doctor, a private practitioner, I wonder how many hospitals in Lagos State would be prepared if we had a situation where the center at Yaba can no longer, you know, in terms of capacity, can no longer take more patients. How are private hospitals going to step up to the plate? Are they equipped? Do they have testing? Can we rely on these hospitals for testing kits? What's going to happen?
Well, let me first of all say that I'm sure the question you're asking is not about those patients who would get better anyway. You're talking about that small percentage that are so severely ill that they would require hospitalization for respiratory support, oxygen therapy, and maybe even mechanical intubation and ventilation. So that I imagine that's the category of people you're talking about. So, how many private hospitals can do this? Off the top of my head, I don't know, but I would think you could count them on the fingers of 2 hands. In other words, maybe less than 10.
We have a population of about 22 million in Lagos. Obviously, that will fall short. Well, so is there any, can they begin to get equipped or better prepare? I know the Nigerian Medical Association has been having meetings. I imagine that those are some of the conversations that have come up. So what is being done to better equip these hospitals, maybe even for the basics, have a properly equipped emergency room at least. So those who are coming in maybe have just moderate symptoms could be treated, and then of course be treated as outpatients, and those with more severe symptoms could be hospitalized.
Yes. So preparedness on that level is actually quite good in the private sector. As you can imagine, the people who access the private sector are not only fewer, but have the ability, a better ability to pay for these services. So at whatever price, many of the private hospitals that are prepared, at whatever price, they've had to spend that money. And I can tell you from personal experience directly now that there is a WhatsApp group. Indeed, there are lots of groups that are constantly in discussion, of groups of private hospitals, their medical directors, and their various leaders constantly collaborating to ensure that if a patient actually does turn up, that requires that level of care. There is a collaborative effort among the private hospitals.
When you say collaborative efforts, in terms of,
in terms of everything.
Who has testing kit,
Yes.
who doesn't have, if I walk into private hospital A and I need a testing kit, if it's not available, what happens then? Does somebody make a phone call to get it across?
When I say collaboration, I mean that in every sense of the word.
Okay.
Testing kits, PPEs, that's personal protective equipment, the actual medication, believe it or not, there is some medication that's believed to work. Chloroquine, hydroxychloroquine. We haven't seen the randomized controlled double-blind studies, which is the gold standard. But yes, azithromycin, there are drugs, there are measures.
Sorry to butt in. Some might ask, okay, affordability, I walk into this private hospital. I mean, what could be the potential cost to me?
Right now, I have no idea because it's multidisciplinary. Intensive care abroad, for instance, it depends on what part of the world you are, but as a barest minimum, using the UK as an example, a ventilated patient in intensive care will cost you £1,000 a day.
And this is even, because even minus the testing kit itself, obviously the person has to get tested first. I know that is not even cheap, outside of what the Yaba Center is doing.
When you say tested first, you mean before treatment?
Before, yes, after confirmation.
No.
Doesn't the test come first and then there's a confirmation?
There are lots of respiratory conditions that require intensive care, respiratory support. Ventilators didn't come because of corona. We've been ventilating patients before corona because they have severe respiratory disease. So if you come in the time frame for getting the result of the test might not be compatible with life. You will have to start treating and test at the same time.
Oh.
So when you get the result, it will now determine how you treat the patient in terms of contacts, the staff, but you will take universal precautions. That is what we call it in the field, universal precautions, where you treat everybody as if they've got.
Akintunde, let me bring you in here. You know, while we were talking, I was just informed that, because as at the time we started our conversation, we had 27 confirmed cases across Lagos, Oyo, Abuja, and Ogun State. But now we're here, we have 5 new additional cases. So that brings the number to somewhere around 32. We have 2 recovered. So I suppose at this point we can expect the numbers to grow, to increase. Just your thoughts on how, as a people, maybe in terms of having a mind shift now and accepting that this is our new normal. I know that there's awareness going on, but what more would you like to see in terms of educating Nigerians and allowing them to know that this is no longer a normal situation, and for now, it's actually okay to live in this abnormal situation?
Sure. And look, this program that we're on now is clearly one of those additional efforts that I would like to see more of. So absolutely we have to inform the general public that this is no longer the sort of thing that they can say, well, you know, this is Africa, it's hot and we're not going to get it. And, you know, there are lots of...
I guess all those myths have been...
Yes, there's a lot of disinformation, and you know, sometimes it's deliberate, sometimes it comes from abroad. You know, everyone's on a WhatsApp group and everyone's sort of, you know, preferring some sort of solution or the other, or some sort of, you know, point around, you know, we're not going to get it. It's here. It's going to happen. Severity is going to determine outcomes to a large degree, as Dr. Oyesola said. I would like to see more information, more education, a lot more advocacy to say, you know, this is what happened here, this was the pattern, and this is how they were able to actually contain it. And I think more of those case studies, the more we bang on about this, the better. I think it's clear, as I said earlier, that, you know, what we're not necessarily looking for is to continuously confirm by doing more and more tests. Now we need to look at the public health side of this and actually begin to let people understand that, you know, you cannot shake hands willy-nilly just because you want to. You know, going to parties is probably not a good idea. Going to the market is probably not a good idea. You've got to hand sanitize. It's just all of the education around the things that we know work and will slow this, the spread of this down. Because if we slow it down, it then gives us a chance to actually find a solution. And you know, and whilst it might eventually spread far and wide, we can deal with, you know, some of the issues better because there's a continuous learning process going on.
Okay, gentlemen, thank you so much. That's all we have time for today. But thank you so much for that very insightful conversation there. Thank you for coming. That's it on Beyond Markets. Remember that today my guests have been Dr. Babaseyi Oyesola, consultant in Anaesthesia and Critical Care, and also joining us today has been Akintunde Sawyerr, former head of supply chain at the National Health Service in the UK, talking about what additional measures Nigeria can take to help contain the spread of COVID-19. That's our show for today. Many thanks for being a part of it. Remember, you can watch the show at 5 p.m. West African time daily and have access to all previous episodes of the show on our website. That's cnbcafrica.com. You can also stay engaged with the hashtag Beyond Markets. And of course, you can send your comments and your thoughts to my Twitter handle too. It's at Esther O. Awoniyi. For myself and the team, it's bye for now.